Malo so for mo tuila mo manua ele nei tu la le aso se ma nei o nei aso ia ele tua ilo na lofa malo na nga nei ai tato ia so malava se atua lofa se atua ia fo ia lofa tele mo tato a me sa tu tuila mo manua tato tangata tatalo tangata lofa ele si malesi o pa ia mo malu tuila manua o le aleo o ia se upu le ona se na faile malapi ai ta ono fa pe atu ia malo so e fu maua o fo le so fo ia pe mana ia le la fai mai tai au ia se luna o lima mai fa tai le tua mo le nei so fo o polo kalama nei sa Saili le Atamai o lo lalo ba ai ngale tato kolisi tu fatasi ia male te tai o le sunga prestene fo mai a Rose Bond maka ili pato ia o nei lai tu ala le aso ia o ia foi se polo kalama e tere a polo kalama matamofia i nei tato kolisi tu fatasi e manao mia o na fasala laua tu fa foi tato atunu lea ngā mai si foi polo kalama e mawhai o na o ngā e le ngata ia tato whanau e o mai ine ia o ngā tato kolistu whatasi. Ia ai mise foi ia tangata o si tato watunu. Tasi lea polo kalama o le UCEDD, o le polo kalama nei, o le polo kalama e sosoani i Tama, matina, whanau, o lo a whaina, le mawhawhau, ma le tino ma le mawhawhau. Ia mai e fo ia e si to ina polo kalama e sosoani, e polo kalama ne le UCEDD. O le nei lawa e se awanoa mana ia e savalvali mai e fo inisi o nei polo kalama, se whasoa mai foi. Inisi foi au nga mai si whamanianga e mawhai ona au ngā tuai i tangata o si tato watunu. O le alawa tato whaatasi ai nei i tu la le aso o le sungaya Noel. Noel, what is the last name again? You know, my Filipino is not very good.
Candelario.
Catilario. Ia va ia Catilario?
Candelario.
Candelario. Oh yeah, okay. Candelario?
Yes.
Okay. Yeah, o Noel Candelario. E whai ngā wenga i e le polo kalama le UCEDD. O le whaitua po te mai tai fo tina fo i lea unofo mai i o taftafa. Ia whaitua lea i a Luana Scanlon e le ngalo e atu tuila mo manua i le sunga i a Morris Scanlon i o tatu ia. O le dora le a Morris Scanlon. Te le fo i ala na au na pe i nei tutuila mo manua. O le fo i lau sa vali mai Luana. E tato tautala nua e fo i whamatala mai le wina tunu lawa o le sosoani le ale kolokalama le ale UCEDD. It's good to have you, Noel, here at our program to explain to our community what this program that you have and the MFP. You gotta correct me, okay? This is a talking conversation. So if I'm wrong or you want to correct me, then you say, excuse me, Tima, but it's not that. It's MFP, which it said money follows the person,
yes.
Right? Ya lela la tu mo tu le sunga Noel. Se yo na whamatala mai fui po le ale wingo le MFB. Lea sosoani mai la tu polo kalama isi tatu atunu. Follow the person. My money follows the person. Ia ka uloa menge yo money ia pape. Ia se ka umai la po le ale wingo le nga MFB. Money follows the person. Okay. Ia sau noa ia lau sunga Noel ele pasa mo Noel ale lau tau mawhai atu e whamatala atu e tato ngana. Welcome to Saili le Atamai, Noel, and I think the last time I talked about this program with your boss
last year.
Yeah, last year Tafa.
Yes.
Yeah. So will you please kind of share with us what this is all about and what I'll be continuing to. It's here. You're just continuing it. And can you tell us more about that?
Okay, so good morning, Talofa. So
There's your camera right there. Okay.
thank you, Fatima, for having us in your Saili le Atamai talk show. So I am Noel Candelario again, a data quality and analyst under UCEDD or University Center for Excellence in Developmental Disability. So this I am part under the program of Money Follows the Person, and I want to introduce with me Luana Scanlan as the owner of Prime Consultant, and she is the one that working with me rapid assessment survey. Okay. So first, I would like to briefly overview what is Money Follows the Person before this rapid assessment was built. Okay. So as per the previous,
go to your.
As per the previous interview with Ms. Tafa, the state director of UCEDD.
This is Tafa Tupuola.
Tafa.
Yeah.
Tafa.
Yeah,
Tafa yung mamao.
Tafa yung mamao Tupuola. O iya lea o baba iya li polo kalangan ne yo le UCEDD. Ya lea e whainga na sa wele sunga ya Noel. Ya lea la whamatala tu Noel. Le winga ko mua o tatu le nei fu sosoani I lalo o lato polo kalangan. Yeah.
Okay. So the Money Follows the Person rebalancing demonstration offered through the Centers for Medicare and Medicaid Services, or CMS, was created as part of the Deficit Reduction Act of 2005. A law passed by the U.S. Congress, originally set to end in 2011. The passage of the Affordable Care Act of 2010 extended the demonstration until 2016. The demonstration aims to promote rebalancing objects written in the statute. The term rebalancing refers to efforts to minimize or eliminate barriers to individuals receiving long-term support and services in home and community settings rather than institutional settings. So this means older adults and individuals with a disability living in qualified Medicaid facility can decide where and how they want to live. It gives them to control to live a whole and happy life in their chosen community. So American Samoa is the one of the first to implement MFP in U.S. territory that will launch next year, 2024. So this is a brief recap of what is Money Follows the Person here in American Samoa.
So this program is it helps our community with the disability people, our patients that
Yes.
are out, and
So those people that in the institution like LVJ and Hope House in Patuanga, those people that wants to be transitioned to their home.
and this is when you come in
Yes.
and help them out in a way of transitioning.
Yes.
Okay. E taua I o polokalama lea o whamatala mai e Noel o te se I o polokalama ne mo nai tina po tamafu po waifu po whanau fu I o lo o tausi I institution e o le patuainga po whanmai po na whefu ia o nifunofu matausi ai ia a whapea la ua fia mana o le ainga ua sauni o na abe I le latou tina tama mo o le whanau fo I le whale e tausi ai. Ia nau atu lola I o le polokalama lea e whai le latou susuenga I po na whia tonu ale awala le umele wo o iai le tina ma tama pe ua tonu o na abe I le whale e tausi ai. Ona sosoani la ia Luana, I know you understand Samoan. If I'm saying something wrong, can you kind of just jump in? Yeah, I know, but anyway, so o wanga la lea, na watu la ia whaia la ko suenga ma whaia ko data. Ona o la tō la, e sosoani la I caregivers tausi mai ia le tausia ia tinama tamama whanau I whanmai po whea lava. On the transition le leila e mea la ia ila ale whale Una inala le sosoani ai la ia il polokalama lea. O mea tau tupe, e mawhai fo ia o na maua I se sosoani. In money wise. Sa o mana, okay. Ia, ole polokala, ole anga kungwala le ole polokalama le tau mawhai atua. Le foi la atua amata, le la atua amata le, we're starting this again.
Yes.
Or we're next year.
We're launching.
Yeah, launching next year. Yeah.
Next year.
O tui na polokalama la nei, olo I lalo le wawaina al tatou, o le tatou polisi tu whatasi. O le hafo la eisi ne polokalama whape nei, I nei le tatou polisi tu whatasi. E sosoani ai I tangata o si tatou atunu. Yeah, is there anything else? Olo tau mawhai atua e whamatala atu le tatou angana. Awai ele fa Samoa le sungano ya fa pe fo ia tinaya Luana. Is there anything else done?
Yes. So before we getting on this program, we need to do or gathering data. So
Gather data.
Yeah. So we came up to do the rapid assessment. So before I explain what is all about in this survey, so I need to know the community that what this rapid assessment survey is. So
Yeah, because you tell the Samoan people rapid assessment.
Fast.
yeah. So rapid
Olo
assessment
le rapid foi
survey.
la ele lapi.
So this is a short, rigorous, team-based investigation to evaluate specific programs. So the assessment uses various iterative modes of data collection and community participation to ensure a quick and holistic understanding of the program. So Rapid Assessment Survey was created to help us understand how the Money Follows the Person program can address healthcare here in American Samoa.
Okay. So it's very important that you
Yes.
have this rapid assessment, and that's why you go out to the community and find
Yes.
these people or
Target
patients.
population.
Yeah, the what population?
So we need a target population who are 65 years old and above, then a physical disability with an intellectual developmental disability, a mental health condition like Alzheimer's or dementia, and then have been diagnosed with brain injury or stage 2 or later cancer. Something like that.
You guys go out and assess and look out for these.
Yes.
Yeah.
But
okay.
we especially gather the actual data from LBJ.
Okay, LBJ is where
Yes.
you gather your, and they would be the place to call your institute in your office
Yes.
if they have if they need help for these people. Okay. Oh, okay. Very good.
So this survey is supplemental support documentation for this program.
Yeah. So that's why you need to do this rapid data is to make sure that you cover all these.
Yes.
Yeah. And with these grants and stuff, you need to have these numbers to be able to get the money to help our community. Money is very important.
Yes.
So we have to have a certain number to reach that data number to be able to get and which will help our people. So, and it's very important to awa ona bala mai to tono le ofisa e ta mai pa fa pio yensesi o tinapu tamapu fa na fo wa fa ina fo e to ina fa ma for Alzheimer's lo tango mai Noel. And what's the other one?
Dementia.
Yeah, dementia, Alzheimer's. I to tu na man o fia lolo atanga to sita to atu ni o mo for mi fama I bona ile dementia and Alzheimer's. Quite a lot of people in our community have that now. Why? Ele lo tatu po femi wala yin na emoya na fa mai se wa ma ku kua wa ngalo mea but ilo ole ilo la wafaina ele me la wafaina so me la nai e mana o mi ai ia data sia le officer lea ia ona mawhai ona watu rei tuatata no e ai na to talk to the families and get all the data and everything so you can help them out with
Data is very important, especially in this program.
Yeah.
We cannot say, oh, we have cancer patients here, we have dementia patients here in American Samoa, but where are those data?
Yeah.
We
You
need
know,
evidence.
yeah, with all these grants and stuff, we can't just say, hey, we have 100. Oh yeah, where did that come from? You have any, you know, a kuskusinga va pe wa o feme sa wele 100 lea le famaye le request le data le grant lea. So you're very true. It's very true. You have to have data to support your grant or
Yes.
whatever that you are applying for. Thank you so much, Noel. Is there something else before we go to Luana?
I think maybe later.
Later?
Yeah.
Okay. Later when it's lunchtime, Luana. Okay, Lou. I won't masanya. I know Lou very well. Just like she's Ainga and we call her Lou. So Lou, yeah, thank you so much for coming.
Thank you for having us.
You know, sharing with us the important work that you are doing for our people also. Can you,
I'll just add on to what
briefly tell us?
Noel was saying. So the survey, obviously some of the people like we were talking about who have Alzheimer's, dementia, other types of disabilities may not be able to complete the survey themselves. So we are also asking for people who know people in their family who have these disabilities. They can also jump onto the Survey Monkey on the website and complete the survey on behalf of those people.
Yeah.
So
Okay.
the survey is very quick. It just asks if you or it asks if you are 65 or older, if you have physical disability, intellectual disability, physical disability, and just some demographic information like your age and your gender. But we don't ask for names, so it's anonymous. And then the second part of the survey is asking if you know someone. So that's where you would fill in the information about someone you know who would
But you don't have to put the names down on
Nope.
this. Okay,
We're
so
not asking
nobody
for
knows
names.
who. Yeah. Okay.
Yeah, so it's completely anonymous, and Noel and UCEDD, they're the ones who take care of all the data. So that's, I mean, I'm helping him do the analysis, but the actual data stays with UCEDD. So in addition to the survey, we're also doing it in terms of collecting data. We're interviewing service providers and then caregivers so that we can get more detail about what the needs are, how MFP can help the population, the community who are experiencing these health issues. One of the issues that we have been finding is that there isn't a lot of data. A lot of people are not collecting this type of data, or if they are, it's disconnected. So one department may not be sharing their data with another department. So it's been a challenge to get the numbers.
Yeah.
So what we're going to do is just pull the numbers from everybody,
Yeah.
and we're just going to share
From
all
these
of that.
other agencies that are putting their data together.
Yep.
And that's the only way to help our people. I mean, that's the only way that we'll get help from these grants that we're applying for to help our people.
Yeah.
We're only doing that for that. That's why we apply for these grants. It's for our people, to help our people. And mostly, and it's so important, I'm so moved with the what you're saying about this disability in any kind, you know. Don't be, awole fefe, awole ma. If I be, ka wa kufua no a le usa ngoa mai al tina ya Luana ele ai ele ta o le ngoa pe a le ai na le pawa le mea o le ta o mai o le afaina o iai le tina ta mama pawa na me le mana o ye polo kalama le ia lava la ko data ma numera e ma fai ona na support taile le tato grant le mai if so ani ai la wa le la usa ngoa mai al tina e telefona ngā ofisa e tatau no o atu tuai ainga manu malala whanga e tala no atuai i e fo is na iau whanau o lo o tausia ia ia tinama tama por whanau fui o loo a whaina i se whaama. Luana. Is there anything else?
Maybe did you explain exactly what type of services do you want to explain that MFP provides? So MFP would provide things like rental assistance, food security, so it would support meals, utilities, home modifications, which we are finding from the caregivers is very important because many homes here don't have ramps or rails or things like that to support people who are having a hard time walking. And it'll also support.
This grant supports all
Yes.
these.
Yep. For a period of 365 days. So within that time, within the 1 year, they have to register for the program, and then we'll try and get them all of those services. And so that's the period they have to transition back into the community.
Yeah, lela usau no mai Luana tau a tele le survey lea e te tau lava o na sosoani mai fo'i i leo atu fo'i pe o wala au mai fo'i i nei tato ofisa. E whaatumu le survey lea le tele ani fisili. Na fisili a pe fia ia tangata o le hainga o leo a whaingai. O le a se mai o a whaingai. E la piolo no tala le na whai atu tau. Ele ingi moa pusia e no names no le whaatumu a o le data le mana o ai gato. Ia o na loaila ia e ofisa nei. Pe fia le tupe e mawhai o na apply ai le grant lea. E sosoani e tangata po e fia tangata i o wawhaina i nei si tato atunu. And that is wonderful, even for it's a lot of help, you know. And you know, nowadays, I mean, still, a lot of our people are hesitant to report what's going on, and then they're stressed out or don't know what to do when there's help out there, like us, like this program, you know. Just don't be afraid. Pick up the phone, call, ask around, or whatever other agencies that are out there that are collecting data. Ask them questions. And I encourage other agencies also to work together with you guys, with our agencies here at ASCC. Then we all can put our sources together and apply for this monies that we can help our community people. Not only that, there might be some of our kids here at ASCC that might be affected with some kind of, you know, and they don't want to talk about it.
Well, a lot of them end up being caregivers.
Yeah, and a lot of them end up being caregivers, so we need them to come in and fill out them. And like Luana has said, if you know somebody that's affected with, you can help them out. Come in, you know, like what Jesus says, lofa, your neighbor, love your neighbor. So if you know that your neighbor or your friend is affected with some kind of diseases, so come, I want to talk to you. Is there something wrong? Let's go and talk to this program at ASCC UCEDD and see what they can do to help us. Look how nice that is. Oh, is there anything else?
The last day to do the survey is October 31st.
Okay, that's the due date.
Yes.
Okay.
And we'll have the information on how to get to the survey at the end
we'll put it up on the screen.
Yes.
And the phone number. Noel. Is there anything else you want to say, Noel, about? Boy, you're so lucky to have Luana there too. Oh, we say
teamwork.
He's saying, yep. But when you have good people there to help you out, nothing is impossible. You know?
Even this is a 365 days. It's a big help to our community, especially those people that, you know, not enough money.
That are
It's very helpful.
And you know, nowadays it's so expensive.
Yes.
And then, you know, some are still complaining about no raise, and the food and electricity and phone and everything else is going up. So this is the time to come out for help. You know, don't be ashamed.
Yes.
You know, no, we have help here. So just come out and call the number and see how do you go about in doing this is right here, or maybe you can send somebody at home or at the hospital or at, is that what you do? Is you go out? Yeah.
We go out and then we contact the main person, especially in LBJ.
Mm.
We contact the main person that easy to get data.
Yeah. Yeah. But Luana, is there something else that you would like to?
Covered
You know,
everything.
I really agree with you. If we all work together, nothing is impossible. And like Luana has said, other agencies in the government that does practically the same thing, if we can all share the data and work it out, everything will be fine. You know, with these kind of help from our Uncle Sam, you know, Uncle Sam. Si Uncle Sam, o kaskele okupe maya ya Uncle Sam, ya Uncle Biden, Uncle Biden, President, Uncle Biden. Yeah, so you know, praise God. Ya lofa le tu ya Amerika Samoa, oleh se tu ingat sesuatu. Tangia tuai Amerika Samoa le tuai le mfaya ona le sesuatu mai le tuai atato awafo ilai au mai le atua ia manatu le atamai mama fo fama man to fama maula I to ina polo kalama ni titilo atu luana I se polo kalama au ngā mo tutuila mamanua. So then she'll come out and suggest it to these kind of programs. She's a consultant, you know. Ia aka ulomelio consultant. Ia o ka ngaka ke alu ia ask for help to help out, to consult be mawhai ona mo se grants le mea alu ana. And then she'll look into it and say, yeah, it can be done. We just have to do the work. We just have to go out there and get the data. Ele au mai fua le kupe e mga o ia Uncle Sam. Ia fai le le data luana. Yeah, and then they'll look into it and say, oh yes, American Samoa needs help. And then Tafa will get a letter from the U.S. and say, you are granted 5 point some million for the kasi makabili aka Noel. Okay, Noel, is there any encouragement or something to say to our people
Maybe
out there?
The announcement of the survey. Please don't forget to take the survey. It's only 5 minutes.
5 minutes.
5 minutes. So you can find our survey link in our Facebook page, which is American Samoa UCEDD. Or if you can, step by to our office in the upper
And your
campus
office is
of
the upper
ASCC.
campus here at ASCC.
That is the M1 building,
M1
across the
building.
nursing building.
Yeah, right across from nursing. Okay. And so, but we'll have something on screen for your phone number and who to contact. Yeah, leo to si sila may sunga ya Noel. Yeah, na balao may ang cellphone. May I speak to Noel, please? Noel, ke mga kuwalek polo kalaba. Oh, I think I'm sorry, but I don't speak Samoa. Noel, but thank you so much, Noel, for coming on Saili le Atamai and letting our people know good things that are happening at UCEDD. And not only just this program, but you have media training that's coming up real soon this week.
Tomorrow.
And there are other super programs that UCEDD has offered our community. So don't sit back and just relax and wonder what you can do here and there. Just pick up the phone and ask for help. That's the only way we'll know.
Yes.
Yeah. Otherwise, yeah,
Let's
we'll just sit at home and go, oh, what am I going to do? But thank you so much, Noel. Luana, is there anything else you would like to say before we close our program?
Thank you for having us.
Well, you know what? Saili le Atamai is blessed to have you, Luana, here for Saili le Atamai. And we hope and pray that you will grace Saili le Atamai again with your presence. And on behalf of our president, Dr. Rose On Wakailipato, thank you so much, Luana, for coming on Saili le Atamai and sharing with us this wonderful program that UCEDD is having for our people and for our ASCC students. And also Noel, thank you so much, and our best wishes to Tafa with everything that she's doing great and awesome with the program with UCEDD. Ia o tatou polo kalama na tutuila ma manua talo se ia wa whamalama ina fui o tau I nei tau whamatala atu lava I lo matua I tatou ngangana ia le polo kalama le savalvali mai ai nei Noel ma Luana ai se fesili po se me fi malama atili ai ana watu o atole number ai e wala au mai ai ia ona sosoani atuli o sisi o le ofisa UCEDD o lo whenga wenga ia li ile o Noel ai se upu tuila manua ua le tau tamali I lau whafunga anga ia marua I whale o whingalo whaatalo whātu ma whamani atu le atua I tamama tina matua lo nofo mai whale ma mai mua mai tatu polo kalama. Oa awa Fatima for Langkilde to fast before.